I'm Julia Kosilnik. I'm from section 1. I'm filming my head to toe. I am just showing that my rubric here is blank before we get started. Okay. Hi, how are you doing today?
Good, how are you?
I'm good. My name is Julia. I'm going to be giving you a head to toe assessment today. I'm a nursing student. This is called a head to toe. Have you ever gotten one done before?
Mm-hmm.
Okay, awesome. Can you say your first and last name for me?
Darren Miller,
Okay, and then your birthday?
January 30th, 2004.
Okay, then do you know what city we're in?
Saginaw,
Okay, and then do you know who the president is?
Joe Biden,
And then the current year?
2023.
Okay, so you are a learning-oriented time series, so I feel comfortable moving on. So I'm just gonna jump into health history questions now, okay? Okay. Do you have any current or past medical diagnosis?
I had eczema.
Okay, do you have any current flare-ups at all?
Yeah.
Okay, do you mind if I take a look at that before we move on? Okay, have you seen your doctor about it?
Yes.
Okay, cool. Have you ever had any surgeries done?
No.
Okay, so like no wisdom teeth, no tonsil removal.
Mm-hmm.
Okay, do you have any allergies?
No.
Okay, are you in any pain today at all?
No.
Okay, are you currently taking any medications? No over-the-counters or any supplements?
I take a multivitamin.
Okay, and then do you smoke, drink, do any drugs like that? No? Okay, cool. So I feel comfortable moving on after that. I'm gonna get a set of vitals. Do you have an preference for blood pressure?
No, either one's fine.
Okay, so I'm just gonna do this one right here. And I'm not sure if I asked you, do you have any allergies that I should know about?
I do not.
No? Okay, cool. Let me see here. Okay. And I'm gonna have to ask you if you can keep your legs uncrossed for me while I do this.
Okay.
My diaphragm is on. Okay. Okay, so your blood pressure was 118 over 72. Is that normal for you?
Mm-hmm.
Okay, cool. So that's and that's a good range for me too. So I'm not too concerned about that. And then I'm just going to take your pulse for a full minute.
Okay.
Okay, I'm gonna do it right here. Just gonna find it. Okay. Okay, so your pulse was 72 and your respirations were 16. So those are within my normal ranges. So there's nothing I'm concerned about there. And then I'm going to check your temperature. Do you feel hot at all today? Like you have a fever?
No.
Okay, so I'm just gonna check that out. Okay, you feel normal too, so I'm gonna say that your temperature is around the normal 98.6. And then I also do not have a pulse ox with me, so I'm just gonna take a look at your fingers. And then I'm also gonna check your capillary refill. And those come back in less than 3 seconds, so that's perfect. And then I did not see any clubbing, so we're good with that. And then the normal range is about 95 to 100% oxygen, and I would assume that you are within those ranges because just from looking at your fingers, checking your capillary refill. And then while I'm here, I'm gonna check out your arms. I'm feeling for temperature, and then muscle tone. Everything feels fine. There's some moles, but none of those look too concerning to me. And then I am going to check your radial pulses. I'm gonna have you flip your hands over. Okay, strong and symmetrical. Strong and symmetrical. Okay, and then I'm gonna put my hands on your shoulders, and what you're gonna do a frontward swimming motion and then a backwards. Okay, and then whenever you are ready. Okay, I just felt a little bit of cracking. Is that normal for you? Okay, cool. And then I'm going to have you do this for me. Just checking your range of motion. Do you have any pain when you do that? Sorry. Was there any pain when you were doing the motion with your arms? No? Okay, cool. And then I'm also going to check your cerebellar function. So I'm going to have you do this for me. And then can you do your fingers as fast as you can? Can you put your hands like this and backwards and then as fast as you can. And I'm going to take my pen light here. And then I'm going to have you touch your nose. And then touch my pen light, touch your nose, pen light, pen light, pen light. Perfect. So your cerebellar function is normal. And then I'm also going to check the strength of your arms right now. So I'm going to have you put your hands out like this. I'm going to have you push up on mine. Okay, and then flip them over and then push down. And you can put your hands like this, push out. Okay, and then do the same thing, push in. Perfect. So you had equal strength on each side. So nothing I'm concerned about there. And then I believe that we are all done with the arms. So I'm going to move on to your face. I'm just going to take a look at it. Your face looks symmetrical, so does your head. But I'm going to go ahead and feel your head as well. Let me know if you feel any pain when I'm feeling your head, okay? Okay. Any pain down here? No? Okay. So your head feels as it should, like a normal shape. And then I did not feel your occipital lymph node in the back. You did not say that it was painful, so non-palpable, non-tender. And then do you dye or bleach your hair at all?
I dye every once in a while.
Okay, and then do you ever have any burning or itching when you do that? No? Okay, perfect. And now I'm going to move on then to your face. Can you just give me a smile? Okay, and then can you puff up your cheeks? Okay, and then can you raise your eyebrows for me? Awesome. And then I'm also going to have you clench your jaw for me. Okay, then can you swallow? Okay. And now I'm going to check for 5 different sensations on your face. So what I'm going to do is I'm going to have you close your eyes. I'm just going to tap. You're just going to tell me where I'm tapping, okay?
Forehead, left cheek, right cheek, nose, chin.
Perfect. So I was checking for cranial nerves 5 and 7, and you are good on both of those. And now I'm going to move on to your mouth. So I'm going to have you say cheese one more time for me. I'm going to take a look at your teeth. Okay. Have you ever had any braces? You did? Okay. And then that went well?
Yes.
Okay. Do you have any current cavities? Any from the past?
As a kid, I had some.
Okay. I'm going to have you open up your mouth for me. I'm just going to take a look inside. Can you lift up your tongue for me? Awesome. Okay. I didn't see any incisions because you said that you didn't have any wisdom teeth. Tonsil removal, so everything looks good in there. I'm also going to have you stick out your tongue for me. Can you move it up and down? And then side to side. Okay. Then I'm also going to check your uvula. Do you have a bad gag reflex that you know of? No? Okay. So I'm just going to take this, and I'm going to press your tongue down. You're going to stick your tongue out, and I'm going to have you say, okay? Okay, cool. That looks all good there. And then that was checking cranial nerves 9, 10, and 12. Now I'm going to take a look at your eyes here. I don't see any drainage, any redness. Do they itch at all? No? Okay. So first thing I'm going to have you do, I'm going to put my hands under your eyes. You're going to look up for me just with your eyes, okay? Okay, sclera looks white, conjunctiva looks pink and moist, so I'm not concerned about that. Now I'm going to just check your eye function. Do you currently wear any contacts, have any glasses? No? Okay. So I'm going to have you follow my pen light with your eyes, okay? Don't move your head. Okay, awesome. Now I'm going to have you take a look at my pen light and look up here at my hand. And then my pen light, my hand, pen light, my hand. And switch sides, pen light, hand, pen light, hand, pen light, hand. Awesome. Now I'm just going to shine this light in your eyes really quickly, okay? Just going to check for pupil constriction. Okay, awesome. Your eyes are pearlescent, so that means they are equal, round, reactive to light, and they are accommodating. And then that is checking cradle nerves 3, 4, and 6. And then I'm also going to feel for your sinuses. Let me know if you feel any pain at all when I'm touching here, okay? Any pain? No? Okay, cool. Now I'm going to move on to your nose. Have you ever broken your nose before?
No.
Have you ever been told that you have a deviated septum or any polyps? No? Okay, so I'm going to have you tip your head back. I'm just going to point my light up into your nose, okay? Okay, I did not see any deviation or polyps, so nothing too concerning there. I'm going to have you close your eyes. I'm going to put something under your nose to smell, and you're just going to tell me what that is, okay?
Okay. Cinnamon.
Awesome. Okay. And then that was checking cranial nerve 1, which you did pass. So now I'm going to feel for the rest of your lymph nodes. I'm checking your post-auricular, pre-auricular, submandibular, submental, cervical chain. And can you scrunch up your shoulders for me? Okay, supraclavicular. Did you feel any pain when I was doing that? No? Okay. So I'm going to say that they're non-tender, non-palpable. And then also while I'm here, I'm just going to give you like a tight squeeze right here. Okay, there was no tension, so you are hydrated. And then I was also checking cranial nerve 11 when you scrunch up your shoulders. And then while I'm here, I'm also going to feel for your carotid pulse. Okay, that was strong. Okay, that's strong as well, and they are symmetrical. And now I'm just going to go ahead and listen for any buoys, okay?
Okay.
Switching it to my bell. I'm going to have you hold your breath for me for a few seconds, okay? Okay, no buoys there. You can breathe. Okay, hold your breath again for me. Okay, you're good to breathe. There are no buoys present. Next thing I'm going to do is I'm going to take a look at your ears. I see that you have some piercings. Are those doing okay?
Yeah.
Okay. I'm just going to feel I'm going to actually take a look at them first with my pen light. I do not have my otoscope, so I can't see if you have any scarring or anything in there, but did you have ear infections as a kid?
A few.
Okay, so you might have some scarring, but we're having a good conversation, so I'm not concerned about any hearing at the moment. I'm right now checking for drainage and any redness and swelling, which I do not see. So I'm going to go ahead and palpate your ears, your pinna. Any pain when I do that?
No.
No? Okay, perfect. And then I also see that you have a piercing in your nose. Is that healing okay?
Yes.
Okay, perfect. Before we move on, I'm going to take a quick look at my rubric to see if I'm missing anything. Okay, awesome. So now I'm going to have you turn around for me. I'm just going to, actually, can you stay right there? I'm so sorry. Can you like look up a little bit? I'm just gonna look at your tracheal alignment. That looks good. I don't see you breathing with any like accessory muscles, so that all looks good there. Okay. Now I'm so sorry, I'm gonna have you turn around that way. And I'm going to palpate your thyroid. So what I'm gonna do is I'm just gonna shift your trachea over a little bit, feel on one side, shift it over again and feel on the other. Okay. It might feel a little bit uncomfortable, but let me know if you feel any pain at all, okay?
Okay.
Okay, any pain pain with that?
No.
No? Okay. So that was non-tender then. So now I'm going to move your hair aside and I'm going to assess your back and your lungs. I see you have a tattoo here. Is that new?
No. Not really.
Okay. So did it heal okay then?
Yeah.
Okay, perfect. I'm just going to check for spinal alignment while I'm back here. Okay, spine looks good. I'm also going to put my hands on your lungs. You're going to take a deep breath for me, just checking for symmetry whenever you're ready. Perfect. My hands expanded at the same time, so I'm not worried about that. Next thing I'm going to do is I'm going to tap on each, like this, on each side of your lungs 6 times. Just listening for it. Can you scratch your shoulders back for me? Perfect. Okay. So I'm just going to do that, okay? Can I move this up?
Yeah.
Thank you. Okay, that sounds good. I heard resonance in the lungs on both sides, and now I'm going to go ahead and also tape with my diaphragm. I'm going to do 6 low sounds on each side. We will take a break in between, okay?
Okay.
And then whenever I move my stethoscope, I'm just going to have you take a deep breath in for me.
Okay.
Okay, with my diaphragm. Okay, deep breath. Okay, are you doing okay? Okay, awesome. Okay, I'm going to go ahead and lift this up again.
Okay.
Okay, perfect. Lungs sounded clear bilaterally. And now I'm going to have you turn around towards me. And then I will go ahead and have you lay down. I'm going to take this a little way though, because before we do anything, I'm going to check your jugular vein distension. So I'm going to have you look that way towards the couch. Okay, then look towards me. Okay, no JVD present, so I'm going to go ahead and put this there. And then I'm going to have you pull the front of your gown down. Okay, so what I'm going to be doing here is listening for your heart sounds. But first thing I'm going to do is check out your chest for any lesions or anything. I'm going to feel for temperature. It feels normal. I see that eczema there, but we already talked about that, so nothing I'm too concerned about. I also see some moles, but none of those look suspicious at all. So I'm going to go ahead and find your heart sounds, okay?
Okay.
And I have this on the diaphragm. Okay, so I have clavicle, first rib, first intercostal space, second rib. Wait, I'm gonna restart. First rib, first intercostal space, second rib, second intercostal space, listening to the aortic valve. Okay, I'm switching to my bell. Okay, I did not hear any murmurs, and I heard S sounds, S1 and S2. I'm going over to the left side, clavicle, first rib, first intercostal space, second rib, second intercostal space. With my diaphragm, listening to the pulmonic. Okay, switching over to my bowel. Okay, I heard S1 and S2 and no murmurs. Clavicle, first rib, first intercostal space, second rib, second intercostal space, third rib, third intercostal space. This is Herb's point, listening with my diaphragm here. Okay, switching to my bell. Okay, I heard S1 and S2, no murmurs. Rib, and the clavicle, rib, first intercostal space, rib 2, second intercostal space, rib 3, third intercostal space. I'm gonna go under here, okay? Fourth rib, fourth intercostal space right there. With my diaphragm, I'm gonna give your tricuspid valve a listen. Okay, switching to my bell. Okay, I heard S1 and S2 and no murmurs. Clavicle. Rib 1, first intercostal space. Rib 2, second intercostal space. 3, third intercostal space. 4, fourth intercostal space. 5, fifth intercostal space, going mid-clavicular right there with my diaphragm. Okay, switching to my bell. Okay, I heard S1 and S2 and no murmurs, and I'm gonna go ahead and give that the apical pulse a listen for a full minute. Okay, I heard a pulse of 66, and then when I was doing the fourth intercostal space, that was the mitral valve, and then that was the aortic pulse. Okay, so I feel comfortable moving on, so I'm going to go ahead and pull up your gown on you. I'm going to pull this up. We're going to look at your abdomen, okay? Okay. Okay, cool. I see that you have a piercing there. Is that doing okay? Mm-hmm. Okay, perfect. So I'm just going to go ahead and inspect first. I see you have a few moles, but none of them look any like they should worry me at all. I'll go ahead and take a look down here. Okay, I see your abdominal aorta pulsating. I'm going to look down here for symmetry. Okay, I saw symmetry, so that is good. I don't see any lesions, any bumps that I am concerned about. So I'm going to go ahead and auscultate in all 4 quadrants, listening for 4 to 5 bowel sounds. With my diaphragm, the right lower quadrant, right upper, left upper, left lower. Okay, perfect. I heard 4 to 5 in each quadrant. I'm going to switch over to my bowel and listen for any bruits in your abdominal arteries. Okay, find that. Okay, no bruise there. Coming down to the right renal. Okay, no bruise. Left renal. No bruise. Left iliac. No bruise. Right iliac. Okay, no bruise. So after listening to that, it sounds all good. So I feel comfortable moving on. First thing I'm gonna do is percuss 3 times in each quadrant, okay? So it's just gonna be the same thing as like the tapping on your back, okay? Okay, so I heard timpani in your abdomen, so now I'm going to percuss from your waistline up and to find your liver, okay?
Okay.
Okay, so that's your liver right there. It doesn't sound enlarged, so I'm not going to be too concerned about that. And then the next thing I'm going to do is lightly palpate, feeling for any bumps or anything underneath your skin. Let me know if you feel any pain during it at all, okay? Any pain with that? Okay, so I'm going to go a little bit deeper, okay? Again, let me know if you feel any pain. Any pain with that? No? Okay, awesome. Then I'm going to move on. I am going to feel for your femoral arteries, okay?
Okay.
So I'm gonna have you lift this leg up for me. I'm just gonna reach down here and try to find that femoral artery. Okay, you can go ahead and put that leg down. Okay, then you can go ahead and lift this up. Find that. Okay, you can go ahead and put that leg down. Okay, they are strong and symmetrical, but I'm just gonna keep my, oh, I better not, because I'm gonna put my stethoscope on. Okay, turning it to, oh, it's on the bell. I'm gonna go ahead and find that again. Okay, I'm gonna go ahead and give that a listen. Okay, no bruise. I'll find this one. Okay. Okay, no bruise. Awesome. So I'm going to move down to your legs. I'm going to cover you back up here. I'm just looking to look at them first. I see you have some bruises. How do we get those?
Just hit like a table or something.
Okay, awesome. I'm going to check for temperature. Temperature feels fine. Checking for muscle tone. Edema at the same time, which I do not see. Okay, muscle tone feels fine. Then I'm going to feel for your popliteal pulses. Okay, they are strong and symmetrical. I'm going to feel for your posterior tibialis. Okay, strong and symmetrical, and then pedalis, dorsal pedis. Okay, strong and symmetrical. And while I'm down here, I'm going to take a look at your feet. They look fine. I'm going to check for capillary refill down here. Okay, they come back in less than 3 seconds. Perfect. Now I'm going to do a sensation test in your legs. So I'm going to do the same thing on your face, but one side is going to be dull like this. The other side's going to be sharp. Can you feel the difference? Okay, awesome. So you're going to close your eyes. You're going to tell me where on your leg I'm touching it and if it's sharp or dull, okay?
Okay. Dull right thigh. Sharp left thigh. Sharp left knee. Dull right knee. Sharp right shin. Sharp right shin. Dull right knee. Sharp left shin. Dull right knee. Sharp right shin. Dull right knee. Sharp left knee. Dull right knee. Sharp left knee. Dull right knee. Sharp left 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 Dull left shin. Dull left ankle. Sharp right ankle. Dull right foot. Dull left foot.
Okay, awesome. Now that I did that, I am going to have you sit back up for me, and then without touching your feet to the ground, just let your hands hang out there. I'm just gonna feel again for building muscle tone and temperature. You both feel fine. And then this is gonna be like the same thing that we did on your hands. We're just gonna test the strength in your legs and your feet. So I'm gonna have you press down like on the gas. Perfect. Push up. Awesome. And I'm gonna check your patellar reflex. So I'm gonna have you scooch a little bit more. Try not to touch your feet to the ground. Do that one more time. Okay, perfect. And then before we move on, I'm gonna check my rubric one more time, okay? Okay, perfect. So I do feel comfortable moving on. So I am going to hand you your socks to put on there. Is that just one of them? Or both of them? Okay, perfect. Okay, now I'm gonna have you put your shoes on for me. Okay. Now I'm gonna have you stand up for me. Do you feel fine? Do you feel dizzy at all?
No, I feel fine.
Okay, so I'm gonna have you stand shoulder width apart, and then I'm gonna have you put your hands by your side, and then close your eyes, and then try to not sway just for 10 seconds, okay? Okay, awesome. So that was not the Romberg test. That was cranial nerve 8. I did not see any swaying, so I would give that a negative. So next I'm going to have you walk over here a few steps. I'm just going to watch how you're walking. Okay, turn around. Okay, now I'm going to have you do the same thing, but do heel to toe walk, okay? Okay, and back. Okay, perfect. Your gait was normal. There was no swaying. I wasn't concerned about you falling at all. And then considering your health history, skin moisture, your skin was intact, no friction or shear. So I would give you a Braden score of 23. And yeah, you passed your head to toe. Thank you.
Thank you.